the first section of Orange's musculoskeletal training for medics, we will discuss MSD definitions and responsibilities, anatomy, and causes of pain. Musculoskeletal disorders, or MSDs for short, occur when risk factors exist in the workplace that may have contributed to the disorder's development or aggravated a pre-existing condition. Common MSD terms are cumulative trauma disorder, CTD, repetitive strain injury, RSI, musculoskeletal injury, MSI, work-related musculoskeletal disorder, WMSD, or sprains and strains. MSDs are commonly diagnosed as back pain, carpal tunnel syndrome, epicondylitis, muscle strain, rotator cuff disorder or syndrome, tension neck syndrome, and tendinitis. MSDs are injuries to the soft tissues of our bodies, including muscles, tendons, ligaments, nerves, blood vessels, joints, and even cartilage and discs. MSDs are not caused by traumatic events or injuries. MSD claims account for 42% of all lost time claims, 42% of lost time claim costs, and 50% of all lost time days. Between 1996 and 2004, there were 328,000 WSIB-approved MSD claims, 27 million lost time days as a result of MSD claims, direct WSIB costs of $3.3 billion, and combined direct and indirect costs of over $12 billion due to MSD claims. It's critical to understand that MSDs can develop over time and can sneak up on you. The earlier that an injury is treated, the better the chance of full recovery. The longer an injury goes untreated, the better the chance of developing a lifelong impairment. This type of injury affects all aspects of your life, and it is only you that can do anything about it. The single most important thing that you can do to prevent an MSD from developing is to report symptoms early. Employers have a general obligation or duty to ensure that the health and safety of every person employed by them is protected while they are working. Furthermore, employers have specific duties in regards to each workplace they control and every work activity under their authority that occurs in a workplace that is beyond the employer's control. The Canada Labour Code, Part 2, places several obligations on the employees, all of which have the goal of preventing occupational-related injuries and diseases. Employees have a responsibility to take all reasonable and necessary precautions to ensure their health and safety and that of anyone else who may be affected by their work activities. Nobody knows a workplace better than the people who work in it. Part 2 of the Code gives the workplace parties a strong role in the identification and resolution of health and safety concerns. The provisions of the Code are designed to strengthen employers' and employees' self-reliance to effectively deal with occupational health and safety issues and, in so doing, make workplaces safer. Anatomy. One of the most important biomechanical principles is keeping the spine's neutral curves. The neutral curvature of the spine is an S shape, with a slight forward curvature in the cervical or neck region, a slight backward curvature in the thoracic or upper back region, and a slight forward curvature in the lumbar or lower back region. The cervical region is a flexible portion of the spine which supports the skull. In the thoracic region, the vertebrae are larger and are more rigid. This region of the spine provides points of articulation for the rib cage. In the lumbar region, vertebrae are massive and mobile. This section of the spine carries most of the weight of the body. The shoulder joint contains three bones: the clavicle, the scapula, and the humerus. Tendons and ligaments attach at this joint, with the articulating muscles being in the upper back, chest, and upper arm area. So although it is a complex joint, it does not contain a lot of bulk. When using awkward postures such as slouch sitting combined with reaching, or working with your arms away from your body, the space within the joint is lessened, increasing the risk of joint impingement, tendinitis, or bursitis. Now let's move on to the elbow and wrist. The muscles that allow you to bend your wrist up and straighten your fingers attach to the outer elbow. Tennis elbow, or lateral epicondylitis, is a painful condition of the elbow caused by overuse. Not surprisingly, playing tennis or other racket sports can cause this condition. However, several other sports and activities can also put you at risk. Tennis elbow is an inflammation of the tendons that join the forearm muscles on the outer side of the elbow. The forearm muscles and tendons become damaged from overuse, repeating the same motions again and again. This leads to pain and tenderness on the outside of the elbow. Medial epicondylitis, or golfer's elbow, is another type of elbow injury. Golfer's elbow is an inflammation of the tendons that attach your forearm muscles to the inside of the bone at your elbow. The forearm muscles and tendons become damaged from overuse. This leads to pain and tenderness on the inside of the elbow. Carpal tunnel syndrome is a common condition that causes pain, numbness, and tingling in the hand and the arm. The condition occurs when one of the major nerves to the hand, the median nerve, is squeezed or compressed as it travels through the wrist. In most patients, carpal tunnel syndrome gets worse over time, so early diagnosis and treatment are important. Early on, symptoms can often be relieved with simple measures like wearing a wrist splint or avoiding certain activities. If pressure on the median nerve continues, however, it can lead to nerve damage and worsening symptoms. To prevent permanent damage, surgery to take pressure off the median nerve may be recommended for some patients. Now, let's move on to spinal discs. The primary function of discs is to act as shock absorbers. They also act as spacers between the vertebrae and are attached firmly to the vertebrae above and below, holding them together very strongly. Because of their shock absorption and spacing properties, they permit movement to occur along the spinal column. The vertebrae are really only a big block of bone. If there were no discs between them, the vertebrae would push into each other, and there would be no movement. The presence of the discs allows for small rocking movements to occur between each vertebrae. The annulus is the outer part of the disc and surrounds the nucleus. It's made up of strong, crisscrossing elastic fibers. The center of the disc is the nucleus. It's made up of a jelly-like substance which contains about 88% water when the discs are young and healthy. With age, the percentage of water decreases and the discs lose their ability to function as shock absorbers. The term slip disc is a misnomer. Discs cannot slip. Instead, jelly-like material protrudes from between vertebrae, creating the impression the disc has moved. Protruding discs can place pressure on nerve roots, creating neurological symptoms such as numbness and weakness in one or more limbs, depending on the nature of the injury. Now, let's look at the causes of injury and pain. Poor body mechanics. Incorrect repetitive lifting and positioning can cause excessive stress on one or more structures of the spine, eventually causing irritation and pain in these structures. Flexing the spine, holding the weight away from the body, or twisting the spine will increase intradiscal pressure, causing the disc to continually bulge backwards, potentially causing one or more discs to protrude. Sustained or poor posture. Prolonged positioning, greater than 15 minutes without a break or change in position, can cause pain due to constant stress placed on one or more structures of the spine. It may also create stresses to the discs and ligaments, eventually causing discomfort or pain. Forceful exertions. Forceful exertions result when a load shifts suddenly or unexpectedly. For example, when two or more workers are carrying a load and due to a lack of communication, a dramatic increase in force occurs. often resulting in one of the workers being subjected to a sudden increase in force, exposing them to a potential injury. Stressful working and living habits. Baby boomers are sometimes called the sandwich generation because they're required to care for their aging parents and children still living at home. This reduces the time available for stress-reducing activities such as hobbies and exercise. Changes in business practices, such as downsizing and performance-based compensation models, have also placed additional stress on workers. Technology has improved convenience and efficiency, but increased efficiency is often associated with work of a repetitive nature, and this places repetitive sustained stresses on the same body structures. Examples include office workers that, until a few years ago, shared a printer with several co-workers. This required them to get up from their desk to retrieve printed material. Technology has reduced the price of printers to the point where they're inexpensive, and many workers have a printer within their sitting reach. As a result, they can sit and work uninterrupted for extended periods of time. This improves efficiency, but places additional physical stress on the body. And finally, loss of flexibility and physical fitness. Individuals with poor flexibility are more likely to be injured when an external force is applied to the spine. Without full movement, the spine is unable to accommodate this strain effectively. Imbalance of flexibility can cause increased spinal stress. Poorly conditioned individuals fatigue more quickly, reducing their ability to accommodate stress or extra loads. Their ability to recover quickly when an injury is present is also decreased. Well-conditioned individuals tend to recover more quickly than poorly conditioned individuals from the same type and severity of injury. The fact of the matter is, patient location, obstacles, and required workspaces dictate that improper postures may be required. However, the more often workers maintain proper biomechanical principles when they can, the less likely it is that necessary improper postures will lead to problems over time. Now you'll be asked a series of questions to reinforce the subject matter before moving on to the next section.